Good afternoon. I'd like to call the Cuyahoga County Health and Human Services and Aging Committee to order today. Today is Wednesday, March 16th. We're already in the middle of March, and it's currently almost 1:10. Can we have a roll call, please, Madam Clerk?
As a reminder to all in attendance, this meeting is being recorded and live streamed on the county YouTube page. Calling the roll, Ms. Conwell.
Present.
Mr. Sweeney.
Present.
Ms. Turner.
Present.
Mr. Miller.
Present.
Ms. Stevens. Ms. Stevens is absent at the moment. We have a quorum.
Right. Can I have a motion to approve the minutes from the March 2nd meeting?
So moved.
Second.
Okay, moved by Turner, seconded by Miller. All in favor, please say aye.
Aye.
All right, just before we read the matter referred to committee into record, Administrator David Merriman will not be with us today. He is in another meeting. So we will have Director Sirac, and I don't know if you're presenting, not Paul? Okay, so Director Sirac will be presenting today for that. Madam Clerk, if you could read the first item into the record, please.
Excuse me, Madam Chair, we do have 2 public comments.
All right, I'm moving swiftly. Sorry about that. Who do we have?
The first person is Leslie Robbins.
There we go. Good
morning.
afternoon, everyone. And it's been quite a while since I've done anything like this. My name is Leslie Robbins. I am currently homeless and a medical refugee from the state of Michigan.
Excuse me, Ms.
And-
Robbins, can you speak a little closer to the microphone?
I'm sorry.
And you can remove your mask to speak if you'd like.
Okay, thank you.
You're
Is
welcome.
that better?
Yes.
Okay. So I'm a medical refugee. I needed a second opinion. The hospitals in Michigan are quite overwhelmed with COVID. So my option was to move here. One of the things that I've run into with being homeless is that we don't seem to have a very good definition of who is homeless, who is vulnerable, and who isn't, but also the needs in the shelter are mostly not met. We did have a guest meeting today. I'm at the YWCA on Payne Avenue, where they've decided to begin behavior reports. And that's a great improvement for those who are having difficulties with addiction or other behavior problems from cognitive impairments or other things. They're finally going to start noting those and trying to do behavior modification with mandatory meetings in order for folks to stay. The other things too is we're supposed to be in transition for a refit of the building. And so we're not getting much information of when do we move, what hotel we're going to and stuff like that. We still have problems with some staff members lying about their names or refusing to wear their name tags, or they'll put their hand over their name tag so that when they start yelling at you and calling you names, you don't know who that person is. So our grievance system is not working. It's not been easy being there. I've been there since December. And I'm in hopes that, I don't know if it needs to be a HUD thing, a state thing, or a county. If there could be any help given to us, I'd appreciate it. Thank you.
All right, thank you, Ms. Robbins. And Director Sirac is in the audience. Do you know who she is? I'm sorry? Director Sirac from Office of Homeless Services is in the audience. Do you know who she is?
No.
Okay, so she can make her introductions. Well, she'll come up in a minute after public comment, so
Okay.
you'll know who she is, and maybe she'll have a few minutes to talk to you about some of
Okay.
those.
Thank you so much. Appreciate
You're
it.
welcome. Next person?
Lou?
Good evening, everybody. Oh, sorry. Good afternoon, everybody. I was still thinking about the
last evening, that wonderful community meeting, which was hosted by Ohio City Incorporated. Our beloved Ms. Rack, she was there presenting the important information to the community there as well. Sorry about that. All the things the other lady just mentioned, those are new to her, but not new to our shelter system. It has been on for more than a decade. It has been the issues, one incident after another. If you right now you want to check some reports with YWCA, nowadays they will even write me up for me just talking loud. But when other people talking loud, that's okay. When people like me or maybe like her, when we talk loud, it's not okay. They will threaten us. I will write you up. I say, okay, then I will write you up too. How about that? The situation has been gone out of hand. The same issues I mentioned actually last evening's meeting, community meeting. Communication has been very lacking for decades. For example, now we even have a situation people believe that we will be charged to stay in the shelter. If you have to be assessed by your temporary job and pay $400 or $500 to stay in a homeless shelter, you will have no way to save up any money to go into a more permanent, more stabilized housing. Now, I have brought in lots of daytime, nighttime soap operas here because that's the reality for the people struggling, even just to stay in the dangerous shelters here. Okay? Not only people got beaten up, you have met Gina Calabrese. She just got beaten up last week again by a person beating her up 3 rounds. The second and the third rounds, even the staff working there got hit as well. So should we really have a heavily congregated shelters? We should not even have this kind of setting from the beginning. But the people think that homeless is a choice, or homeless people, you are lazy, you don't make effort. So homeless people, the human rights are even not paying attention, being disrespected, being thrown away. There's nothing Ms. Sarek can help us immediately. She works for government in an underfunded, understaffed office. Yes, everything's stuck with the money. We do really need to know where the money has been wasted. In the shelter system, definitely it's all those bad staff. They are getting paid. That's why we cannot get adequate food. And there are other systems in the government is getting ripped off. That's the reason why an important health human service office cannot get properly staffed and funded. We need your help, very, very much indeed. Not just this ridiculous transition to move a shelter to another location. Eden has promised they will have multiple meetings to connect with us. It has not happened either. Thank you.
Thank you, Ms. Liu. Madam Clerk, is there anyone else signed in for public comment?
No, Madam Chair, there is no one else signed in.
I'd like the record to reflect that Councilwoman Stevens is in attendance, as well as we are joined by Councilwoman Simon. If you could, Madam Clerk, read the item into the record.
Resolution 2022-0061, authorizing an amendment to contract number 585 with the Salvation Army for supportive services for homeless men in the Pickup Assessment Sheltering Service PASS Transitional Housing Program for the period January 1st, 2021 to December 31st, 2021, to extend the time period to September 30th, 2022, and for additional funds in the amount not to exceed $730,701.
Thank you. If you can state your name for the record as you come up to the podium. Thank you.
Good afternoon, Marcos Cortez. I'm actually representing Paul Porter, who's on vacation this week and maybe even beyond this week. This is, again, a contract amendment with Salvation Army for the PASS program, which, as you heard, stands for Pickup Assessment Sheltering Service, in the amount of $730,701. This program provides temporary housing and rapid rehousing assistance and recovery for up to 75 homeless men at any given time, and an average of 150 to 200 men annually. The primary goals are to provide basic temporary housing and safety net services for these 75 homeless men, to link clients with permanent housing and to support clients in accessing earned income, recovery supports, and stable incomes. This is an amendment from an RFP that was issued a couple years ago. We're exercising an option year for this amendment. The funding comes from the U.S. Department of Housing and Urban Development, which pays for 74% of this contract, and 26% comes from levy dollars. We have supported the PASS program since 1994, and Salvation Army has demonstrated the capacity to operate the program within budget and achieving their outcomes. We have representatives from the Office of Homeless Services and Salvation Army here to answer any questions.
Could you, Mr. Cortez, can you repeat those figures? 74?
74% comes from the Housing and Urban Development Homeless Assistance Grant, and 26% comes from HHS levy funds.
Okay, any questions for Mr. Marcos, for Mr. Cortez?
Yes, I have one.
Yes, Councilman Miller.
My question is, are there one or more additional option years that are available in this contract?
There were a total of 2 option years, I believe, and this is the first one that we are exercising.
Thank you.
I had a question. I never remembered the term. I remember PASS, but I don't remember the term in the legislation. Pickup assessment, sheltering. I know that stands for PASS, but I don't know if I don't know why I can't remember that term being utilized before.
The PASS program?
Yeah. The acronym, but never, the words. So whoever would like to speak to that.
Go ahead.
Do we know why we call it the pickup assessment sheltering service?
The Chairman Bo Hill from the Salvation Army. Since the inception of the program, it has been called that, and the whole intent of that was pick up assessment. So you pick up someone out of homelessness, you assess them, and then sheltering services. And so that was the name of the project, since its inception in '94, and we. Over the years, the funding has changed a little bit, but the intent of the program has remained.
In terms of, Mr. Cortez stated that that roughly there's around 150 to 200 men on an annual basis. How many of them are, I guess, new to the program, or how many have you moved out in a year?
So I'm going to use some data that the funding is different, and the funding year is October 1st through September 30th. So this is the from ending September 30th of 2021. There were 193 people that were served. That's a little bit lower because our length of stay was longer with COVID. There were 131 of those individuals that left the program, and of those 131, 80% of them moved into a more permanent placement. And so about half of those people that left to a more permanent placement were placed in CMHA. The other half were done in some sort of, rapid rehousing, voucher, or family and friends sort of placement.
And you said how many in permanent place? Was it 80?
80% of those, and that's a little bit lower than we traditionally been. It's traditionally been in the mid-80s, but I think the challenges associated with getting people housed and everything like that was very evident during the last couple of years.
Okay, so when you speak of, Bo, of the funding year, October 1st to September 30th, is that also how you're looking at placements from that time frame to then?
Well, when we run the report, we ran the report from our system based on that year. And so there's different funding time frames, and so some people like to look at it on a calendar basis. Sometimes people like to look at it on a fiscal year basis or funding year. And so the data that I'm sharing with you is from October 1st of 2020 through September 30th of 2021.
Okay, so the top number was 193 people were serviced.
Unique individuals.
And you explained where the other ones went. The other 62, roughly around 60 people, did they remain at your men's shelter?
Correct, yeah, so at the end of the year, the number of people that were remaining are the people that would be currently active in the program.
And also remind the committee, if I'm correct, that this is an age group that stays at, or is it various age groups?
It's
thought it was
various age
younger.
groups, but they're adults, so 18 and over.
Okay.
And so the average age, you know, I've been there for 25 years. The age used to be a little bit older. Now it's a little bit younger population we're seeing.
Okay. Any other questions from the committee in regards to this? Okay, hearing anything else that you guys would like to share? Anything you'd like to add, Director? Welcome.
Thank you. Good afternoon, Melissa Serac, Director of the Office of Homeless Services. I would really want to thank Salvation Army and Bo specifically. As you all know, and I know you've heard from me over the last year or two, COVID's been rough on our system, extremely rough, and I'm just grateful that they're such a strong provider in our continuum of care and grateful for their nimbleness, their resiliency. You know, we are emerging from the pandemic, but there is permanent challenges that we have to overcome regarding staffing, operations, but really the commitment still remains within the continuum, and especially with Salvation Army and the vision that we've laid out before us as a continuum to serve our community better. So I just want to say how grateful I am and how strong of a partner they are in the continuum. So thank you for your support.
Thank you. Mr. Cortez, is this something that you're requesting second reading suspension?
I believe if we can do that, we would like that to happen.
All right. All right, I'd like to make a motion to move this to the full council under second reading suspension. Is there a second?
Second, Sweeney.
All right. Moved by Conwell, seconded by Sweeney. All in favor, please say aye.
Aye.
Thank you. Thank you all.
Madam Chair, if you don't
Yes,
mind me
go right
adding
ahead.
something, I apologize after what Melissa said. One of the things that I think would go a long way for us as service providers is there are a lot of our staff that are on the front lines that have been on that front lines, and our staff turnover has been over 50% over the last year. If there's some way that the council or the committee could be able to pass some sort of resolution or something, just an appreciation that we as providers can share with our staff, I think it would go a long way. And so that was my only point, and I appreciate you giving me the opportunity to say that.
Definitely will be considered. Thank you for all you do. All right. No other items before us no contracts before us. So we will now have a presentation from Milestones Autism Resources. I believe, would that be Beth? I don't know who's presenting. Please come up, state your name, your organization, and we have your full attention. I don't know if you're doing a PowerPoint, but we do have your presentation at the DS.
Hi, good afternoon. Thank you
afternoon.
very much for giving us an opportunity to speak with you. I'm Ilana Hoffer-Scoff. I'm the co-founder and the executive director of Milestones Autism Resources. Beth Thompson is our program director. And we're happy to have this opportunity to share with you because of a couple of things. One is this is our 20th anniversary year. We've been in existence since 2003. We wanted to provide you with a short overview of what Milestones is, and then also talk about the impact of the support of the council on our help desk and services there. Let me see, so I'm pressing this one. Thank you. There you go. Okay. A bit about Milestones. Let's see. Yeah, there we go. We were founded with the purpose of improving the lives of autistic individuals. That's our primary focus, and we focus on education in order to do that. We support all members of the autism community, and that means the autistic individuals themselves, the professionals who serve them, their caregivers, their families. And the way we do that is by connecting them to resources that our professional staff have reviewed and vetted, as well as helping families prioritize to help them achieve their own personal milestones. Our vision is of a community in which autistic individuals reach their full potential as integrated members of society, their needs supported, their abilities, their strengths valued. Our core service areas for the Northeast Ohio community are National Autism Conference, where in person about 1,000 people would be coming. We've been providing it virtually the last few years. Our website, milestones.org, with thousands of resources, downloadable materials, as well as a resource center listing information about education, medical needs, educational needs, a variety of therapies, our free help desk, which we're going to talk about later, as well as professional consultations and trainings. A brand new feature for us that we have prepared is our MAP tool, the Milestones Autism Planning Tool. And this was an opportunity for us to share with the community what we feel, what we are recommending, how to support families all along their journey from diagnosis through adulthood. It's an interactive tool. It's already available on our website. There are things to download, such as an adult checklist as you're trying to prepare for the future. What are things to think about and look to support your child, your student, or for yourself? What's unique about Milestones is that we focus on every age, stage, and ability all along the spectrum. We serve the entire community, as we said, the professionals, the individuals, and the general community. We are focused on evidence-based approaches and really the practical nature. So you're not coming to us for a school, you're coming to us to help guide you along the way at transition points throughout the journey of autism, as well as opportunities to have a community, to connect with others. I think if you would ask us, what is our focus coming into this year, the last few years, looking toward the future, we feel that diversity, equity, inclusion, and accessibility is informing all of our work in terms of neurodiversity, racial diversity, socioeconomic diversity. It's very important to us to have everyone around the table that is affected, to hear from everyone, to collectively come up with creative solutions. Sometimes these conversations are difficult. Sometimes these are times when we have to reflect and think back about how we've been doing it and how we can improve that. And we're committed as an agency to do that. Sorry, I'm getting the hang of your clicker here. It takes a moment. In our role, because we're looking at how to provide systemic change, we're looking at how we can improve the outcome for all individuals. We're helping to raise the standard of care. We're helping to support professionals in their own personal growth so that they can better serve autistic individuals. We've been hiring neurodiverse staff to show and to learn from. You know, if we want others to do that, if we want to see that happening across our community, that autistic individuals are hired, we wanted to do that as well. We started a number of years ago with interns, and we now have 3 staff working with us. We've been mentoring and providing opportunities for autistic individuals to speak at our conference, to participate in trainings, and I think we've been enriched in this process. Currently, a focus for us, we're working with the Adams Board on providing training for all police officers outside of the city of Cleveland on their interactions, how to support those interactions with autistic individuals. And another important initiative for us is working with healthcare professionals, providing an opportunity and education for them about unconscious bias and helping them to better serve their clients, their patients, with autism or suspected autism across all different communities, all different racial backgrounds and ethnic communities. We don't do this just the two of us. We have a staff of 18. We have a board of directors representing healthcare professionals, therapists of a variety of different disciplines, as well as caregivers and autistic individuals, all working on our board to support our efforts. This is our staff representing, again, autistic individuals, parents, professionals in the field, social workers, those with a background in education. And this is a sampling of some of our partners, just to show in terms of our funding partners, our collaborative partners in the community, in the education space, in healthcare. We're very proud over the last 2 decades of working and building these relationships. I'm going to turn the presentation over to Beth to talk about autism and about the services that are being supported by the council.
Thank you all. For those of you who are not as familiar with what autism spectrum disorders are, we just thought we'd give a little overview. It often gets confused as a mental health disorder, but it's a neurological and developmental disorder. Neurological means it's happening in the brain, and developmental just meaning it happened before the age of 3 and its lifelong impact. These are the 4 core areas that autism impacts: behavior, communication, sensory experiences, and social interaction. And we talk about the spectrum because of this varied way that it can impact people. And you might have heard in previous conversations people referred to as like low or high functioning, but it's really just a large spectrum of where people can continuously move on that line and the supports that they're going to need. And currently, the prevalence is 1 in 44, which was an increase from the last CDC update prior to 2020. So the reason for this another spike in the diagnostic rates is we are doing better in our healthcare communities at identifying children of color earlier on and diagnosing them appropriately. We saw a lot of children of color being diagnosed with mental health disorders as opposed to a developmental disorder. So healthcare providers are improving their unconscious bias and identifying those children and adults. And we also, even though the wait list here in Cuyahoga is still 6 months at Metro to get an adult diagnosis, we really have seen a decrease in wait list across the nation. There has been a lot of research coming out as to the cause of autism. What we do know that's continuously shown in research is that there is an increased rate with the parental age and parental weight. And as a society, we've had children just older in our lives and are producing more children on the autism spectrum. And we do know that there is a genetic, it's about 80% genetic inheritability. So we know that ASD traits run in families. So 10 years ago, Milestones was serving the child. Now we're serving the whole family. Now that parent is on the spectrum as well as the child and serving their different needs. In Cuyahoga itself, we have an estimated population of a little over 28,000. The reason why it's estimated, like I said, there's a 6-month wait list at Metro for diagnosis, and there's hundreds of people on that list. So this is factoring in individuals who are diagnosed as well as who are waiting for a diagnosis. And as Alana said, it's not just serving that child or that autistic adult that a lot of other providers may focus on. Milestones is really about how do we connect the whole community? How do we make sure the providers that they're seeing, from their pediatrician to their teacher, are well trained, and how are we getting those families connected to those best trained resources? Through 2016 up until now, this has been some of the impact that the council's the council support has assisted in. Over nearly 3,000 individuals served through our help desk, which is very similar to like a 211, but specific to autism. And it's going to be answered with somebody who's been in the field for years, or as a parent, or as autistic themselves. We've been able to sustain and really grow this service. One of the ways that we have grown it, which we'll continue to talk about, is our Spanish help desk. So now we have a staff who can take families whose primary language is Spanish and help them through in the same way that we've been helping families for years. We've been able to increase our expertise in our staff. We've professionalized the service provision. We've had a lot of opportunity to have growth around the knowledge of resources. Our resource center is over 15,000 resources, categorized by age, location, and the kind of provider or service, and they're all personally vetted by Milestone staff to ensure they're providing evidence-based services. And we have been able to do a lot of improvement for a lot of tools, such as our toolkits that you can find downloadable online. One of the new ones is the adult diagnosis toolkit, because it is so hard to seek a diagnosis as an adult. This is a chart that shows from 2021 how our help desk and consultation clients heard about Milestones. I know it's very small for you. What I think is of high note, and the colored chart pulled out to the right, is that a great deal of these referrals are coming from the healthcare systems, where we're in training the providers, the residents, the pediatricians. And we're going to continue to build on those relationships with our major healthcare providers, as well as with the County Board of Developmental Disabilities. New in the last 2 years for us that we're really proud about is that we started our Spanish help desk in the midst of COVID. And we're in collaboration and partnership with specific entities. And right now we're focusing on Lake County, but we're really trying hard to dig our heels into Cuyahoga and connecting with local agencies like Esperanza, working hard to make those connections. As well, in the past 2 years, we've had to have a lot of concerted effort as to the needs of our families during COVID. So thank you. So we now have a COVID page on our website that goes over a variety of tools and topics, how to support your kids in wearing masks, to how to start coming back to school with some school refusal behaviors. We've converted all of our meetings over to virtual. We're returning to the office now in person, very, very excited about that. And as Lana mentioned, the map. All of these new services were informed from our help desk callers. Just like our diversity, equity, and inclusion task force, all of these movements came out of requests we heard from our community members calling through our help desk. So our hope now, we just recently hired our Spanish help desk coordinator with a really amazing background, and we're going to continue to expand that service. And we are really excited to deepen our relationships with those healthcare providers that we've been training, that are referring their patients back to us. We're going to be doing help desk in the community through a series of partnerships. One example is through the Cleveland Clinic Learner School for Autism, where Milestone staff are going to be on the campus providing consultations to the families that are receiving exceptional educational care or medical care there, but maybe need help in connecting to other community resources or navigating the systems around them. So as opposed to asking our families to come back to our office, we're going to go into the community and really focus on those relationships that we think are primary for our children and our families' lives. And to that point, we have a fabulous relationship with a leading pediatrician who also serves on our board, Robin Sostracker. And her quote here, "For my patients, the help desk is an excellent resource and source of support. As a professional, it's extraordinarily helpful to have the resource to call when I need it." Just an example of the healthcare providers that we serve and have relationships with, and our continued use of those relationships. And then lastly, we have a testimonial from one of our parents. Milestones is actually changing our lives. It's making our journey a lot easier. It gives me the additional support and help that I wouldn't be able to get anywhere else. That's from Pat Parker, who also participates on our CIT training for police in Cuyahoga. Can I answer any questions?
Yes, I have a few, and I'll just go backwards from where you last left off. So your diversity, equity, inclusion, you stated that you have a task force. What is that task force made up of? How many members, and what is the breakdown of professionals versus parents?
That's a great question. We began the diversity task force 5 years ago. And we try to model it the same way that we model our board, where it's going to be like 1/3 professionals, 1/3 parents, and 1/3 autistic self-advocates. But in our community, there's a lot of layover. So I would say a lot of the professionals are parents, and the parents and self-advocates are also professionals in similar fields sometimes, but we try to model it off that.
That 1/3 professionals, 1/3
Parent,
parents.
1/3 self-advocate.
I'd like to comment a little bit about the Diversity Task Force. Just as Beth was describing, that a number of initiatives that we have taken come from the help desk, we convened the task force, which came from requests from the help desk that families were not getting the diagnosis for their children. So Black moms were coming and telling us, we are being thwarted, we're not able to get the diagnosis. If you don't have a diagnosis, you don't get the services from the school, you don't get the services paid for through other means. So it's a critical barrier to jump over. And so we started meeting with the task force, as Beth said, a number of years ago. From that task force, they provided the recommendations for our diversity initiative. So they're the ones who said, we would like you to work with healthcare providers on unconscious bias. Because if they're not giving the diagnosis, they're not recognizing that we need to work with them. They're the ones who said, we'd like you to provide training to first responders. We're concerned about our kids going into the community and first responders not knowing what autism looks like and what those behaviors are. So our initiatives come from them. Also, the last several years, we've been really taking a look at who our presenters are at our annual conference and taking note of that and thinking about diversity as part of the presenters we bring. The proposal process has information asking how does this presentation dovetail our values of diversity, equity, inclusion? How is that incorporated into your presentation? So there's a lot of impact from that task force.
Thank you. How does your organization work with the Achievement Center?
The Achievement Centers is one of our go-to referral sources. And actually one of our staff used to work there, so I think we probably refer to there even more than some others because of his long-term relationships with there. But I believe Achievement Centers also sits on conference? Yes, as a provider. There's an Achievement Center staff that sits on our conference planning committee to make sure their voices are heard and their needs are being met by our educational offerings.
Okay, and so I don't know if I have this question formulated in my mind right, but so for Medicaid, so when we talk about individuals of lower income, probably usually on Medicaid, does that contribute to the possible wait list at Metro? Okay.
Yeah, I was just pulling data on this yesterday for another provider. Metro is right now the only place that'll take Medicaid and do diagnosis for adults. That's why their wait list is so long.
Okay, because that was my next question. Okay. And looking at the chart, and this wasn't a question that I had written down, but looking at the chart, very small chart, but that's okay. You kind of have like a breakdown of 40% clients referred by other organizations. So you get a lot of referrals I'm looking at from Cleveland Clinic, University Hospital, and Metro. Are they assisting in any way financially? Because they're, especially Cleveland Clinic, because they're sending a lot of people your way. Now, I don't know if that, because I know Cleveland Clinic has a lot of agencies based, but when you think about the main campus and where it sits, that would correlate a little bit for me, but I don't know if you have that breakdown.
So we receive funding from a variety of sources and through a variety of ways. We have our annual conference, and that's an opportunity for providers to work with us, and they do provide some sponsorship through that. Their participation in the conference helps us to provide our service. The other way is that, as Beth was describing, we're working on deepening our relationships with each of the healthcare providers. Specifically with the Cleveland Clinic, we've been working with them. We're now on a second grant with them. They have an internal Catalyst grant program. And so we're working with them to better support their patients. I think having been in the field now for 20 years, we are demonstrating our expertise in a variety of areas. primarily in the transition area, but in across the age spectrum. So we're working on a special project with the Cleveland Clinic so that once the child has a diagnosis, we're working on that connecting to resources side of it. Similarly with Metro, and I wanted to turn to Beth to describe a little bit to address that long wait list. That's why we're working with Metro, to get people the resources even before the diagnosis and then also once they receive it. So we're going for some joint funding with Metro to some foundations to support that. And with the Cuyahoga County Board of Developmental Disabilities, that's another partner for us. Again, we have certain expertise and we'd want to bring it to the other areas that have different areas of expertise. And the county board is one of them. They have the funding sources, they have the staffing and capacity, and we have the knowledge of the resources to connect them to. So this is one area that Beth could speak to a little bit, how to address that long wait list.
A lovely example of how we serve in partnership is the Cuyahoga County Board of Developmental Disabilities heard from Milestones how long the wait list was and how there's this really critical lack of providers, especially those that take Medicaid or CareSource or any other low-income insurance. So the county board actually invested dollars into different agencies. Monarch is one of them, Monarch Center for Autism, to help them train staff on how to provide diagnosis. It's through a test called the ADOS or ADOS-2. And then they're going to supplement and help pay for those assessments through these private agencies so that we can start to take some of these kiddos off the wait list at Metro. So as Alana said, get them diagnosed, get them getting services, which is the most important part. So that was a way we were able to identify a community need. We have a community partner that we know that can fulfill that, and connecting the two of them.
Any other questions? Councilwoman Simon?
I'll defer to the committee members first. Councilman Sweeney.
They didn't raise their hand.
So I'm going, thank you. Did I hear you, though, the Metro wait is for adults and not children, or is it everyone?
It's both. It's both. There's about, was it 600 or 500? For the kids. So there's 500 kids on their wait list, and they just have more providers that can do that. So that wait list is a tiny, tiny, tiny bit shorter. And they're adults. There's only one provider in the county that takes Medicaid. So they're both, the wait list for adults and children are very similar.
So, but you have other providers who have other sources to cover adult diagnoses, just not Medicaid.
Yeah, so if a family
Clinic
no, the clinic actually has no providers, as well as UH has no providers to diagnose adults. I actually just spoke with a doctor yesterday at UH who's become keenly aware of that. But Dr. Leslie Spear at Metro is the only physician at a healthcare practice providing those diagnostics. If a family can private pay, if an individual can private pay, I can send them to a private provider. That's going to be over $1,000 for that assessment. So it's not doable for many.
And just to follow up, so Metro only has one person on staff to
do adult diagnosis.
Yeah,
they don't want it that way, but
they want more.
Oh yeah, yeah.
And what's the saying no money, or what have you been told?
They're seeking additional funding and additional partnerships to try to up their staff. And as Alana mentioned, one of the ways that we want to try to be a stopgap while they have a lack of staff is there are services that we can connect undiagnosed adults to that they don't need the actual autism diagnosis, especially if they have co-occurring mental health disorders that often come with autism. So one of our roles is, okay, if we have hundreds of people on this adult wait list, can we connect them to opportunities for Ohioans with disabilities? Can we connect them to Ohio Means Jobs while they're waiting for that to start getting them some level of service?
So you have the one for Metro for adults. Do you have how many for the children? There's more than one.
Oh, yeah.
Okay.
Yeah, there's way more for children. Yeah.
Okay, and one other question before I go to Sweeney. So my understanding with the Department Board of Developmental Disabilities, in order to receive those kind of services, the child must be diagnosed at a certain age. Is that the same for autism?
It is incredibly hard to get services for an adult if they haven't been assessed like prior to the age of 16 by the County Board of Developmental Disabilities. It's not impossible, but just a little more difficult.
Is that the same in your world as well?
Yeah. Yeah.
Councilman
Thank you,
Sweeney?
Madam Chairwoman. Thank you for your presentation and appreciate all the hard work that you do and the important work that you do. Just on the topic, I have a second one after this, of the wait list. You say there's 200, 300, when you say hundreds, can you give me
If
under 5?
it's 500 for the children,
Just ballpark. is
that's
fine.
just at one hospital. And I'm,
Just what's the problem in the global sense of a wait list? Because Metro is the only one that does it. I'm trying to get a handle on how to try to resolve the
yeah.
issue that's before you.
Right. So one of the critical parts is that we know early intervention actually produces the best long-term outcomes. So the longer that these kids are waiting to get services at their school and their community from the county board, the worse the long-term outcomes are going to be. And as was mentioned, as they age up, it can become a significant barrier to getting services if they're getting diagnosed in their teens or later. One of the primary reasons it's such an issue for us and for Metro is because they're the hospital that, serves the public. And we know historically children of color, children whose families speak Spanish, another language, they're gonna already be receiving lower quality services. And if we don't get them that diagnosis that can get them access to like quality care, that's just gonna be compounded.
Thank you, Madam Chair. I'm kind of a slow, laser-focused guy, so I'm going to try to keep on the point here. How big is the universe of people that you believe that are on this waiting list at one hospital? Is there 2 hospitals? There's 3 hospitals? What I'm trying to get at is how can we reduce the waiting list?
Yeah.
You said you have and Monarch, I think you said, is helping reduce
Yeah.
that.
So the County Board of Developmental Disabilities has reached out, I think it's 7 providers that we identified for them that we believe have the capacity, have the expertise, but don't have staff trained in the ADOS, the official diagnostic tool, and are supporting those staff, funding those staff getting trained, and then we'll be paying for the families that are on the wait list to come off and go to Monarch for that assessment. Or the other 6.
No, absolutely. I'm just trying to. If there's 500.
Yeah.
And there's $1,000, is a $50,000 monetary fine for you to help reduce the wait list?
I don't know if I can answer that.
You mean if we were able to give the money to the people seeking a diagnosis to go elsewhere, so they didn't have to use their Medicaid, they were able to use the $1,000 per person to get the diagnosis?
Yes. So just what I heard from you is if somebody has $1,000, they can give money to somebody and they can get assessed.
Okay, yeah, now I understand.
And if there's 500 people, so it's $50,000 to make and there's folks out there that would be available to make the assessment.
They're in the process of being trained. We started this conversation with the county board in the fall of 2021.
Yeah, I'm just trying to get through the chair.
Yeah.
It doesn't seem like it's a big dollar number, 50,000, or the other thought I have is the other hospitals.
Yeah. So I think maybe the disconnect, now I understand, so I appreciate. The disconnect is providers don't want to take Medicaid reimbursement, so they're happy to take direct cash dollar for what a private provider is going to make.
Yeah.
The hospital is not going to make the same that a provider, like that 1,000 plus, they're not going to make that from Medicaid. So it doesn't help the long-term cycle. If, okay, now we have these 500 off the wait list, we still have another however many that are on Medicaid, right, that those providers are not going to serve on Medicaid. They're only going to serve when they get the actual just dollar from the board. Does that make sense?
Absolutely.
Yeah.
Not really, because I'm just trying to say,
Oh.
it's not a big deal. My thought is.
It's not a way to systemically change the problem. It'll help this waiting list, and we'll just keep going. But this is actually a national problem. This is not just for Metro. This is across providers. This is across the state, that there aren't enough people trained to provide the diagnosis. Plus, the way the system is set up, where Medicaid, they have a choice. The provider says, no, I'm not going to take that. So there are some systemic problems.
Absolutely, but if the $50,000 come on a recurring annual basis in perpetuity, you'd be able to put a
Yes.
significant dent in this.
And
I'm not sure that I'm not sure the total dollar amount that the county
I'm
board
just
of
throwing up
DD.
the concept.
Yeah, yeah. I'm not sure of the amount that they have dedicated in their budget annually, but I know they are.
I'm sorry for making you guys a little bit, I'm just trying to figure it out for myself.
I appreciate the thinking bigger, because I think what you're hearing is there's no shortage of people who need service and support, and we are able to do what we can within the budget we have. I think increasing our budget so that we can be more creative in supporting the community would be welcome, both from us and, of course, the community. I think the message we want to share is that Milestones, as a smaller organization of 1.2, 1.4 million, that's our budget to do all the work that we've been doing. We need to pick and choose our priorities. The wait list conversation is continuing to come up from funders as well, and I think recognizing the role that we can play to help assist would be terrific, because I think we're able to be the connector. And we're also on the ground, so we know what the issues are in each of these providers, as opposed to them knowing from each other, and we're also hearing directly from the community.
Awesome. I'm going to ask another one, Madam. Mm-hmm. Just in my previous world, I got to have a tour of the Autism Center at.
Excuse me, Mr. Sweeney, can you speak closer to the microphone?
And-
Thank you.
Would you say autism was kind of in the shadows for a while, and now it's coming out and being mainstream of there's an issue, we need to get it addressed, and we can have significant help? Is that a fair statement?
I think definitely. I mean, I think you see how the incident rate is rising. I don't think there are suddenly more people. I think we're recognizing it, we have better identification, and we're seeing it as a spectrum across all humans, as opposed to there are few people who are a little bit quirky. Everyone is somewhere on the spectrum of need.
You're looking at one through the chair, but when I went there, they were so excited, and it was so small, and it was maybe 15, 20 years ago, and just seeing becoming mainstream in regards to understanding and recognize and the significant results that come from it. So with your group here, it's just, and your statement of it needs to be diagnosed. So I'm going to be stuck on how to get that wait list down, and in a systemic way to make it work. And all our hospitals are wonderful. They just don't do it. But they have so many different wonderful charitable components of theirs. Could we shift from one to another? You got me thinking about it.
Totally. And I don't want you to stop at diagnosis, because I think connecting to therapy and intervention and education is where we come in and help the family actually make some strides.
Yeah, and
So we can't stop. It's got to be connecting to the next step, too.
the success story when a family is struggling with a child or an adult with this condition, and it turns out to be understood and figured out, and their lives have fully turned 180 degrees. And I've seen a couple of those, and it's just incredible. So I'm very happy that I got the more of a current update, and I appreciate my chairwoman getting you here so I can understand a little bit better. Thank you, Madam Chairwoman.
One last note is that we do encourage you to go to our website, milestones.org, see the new map tool, reach out to any of us. I do have my business card as well. I can, if you don't mind passing it out. And I also, we will send through Ashley an invitation to our annual conference, which is virtual. And that's another great learning opportunity for you. So we can share that with you too. It's in June.
All right. Any other questions? I had a few, so I'll definitely appreciate your card so I can follow up on just some of the
Thank you.
the problems and the issues that we have. So seeing none, thank you, Donna. Seeing none other, because this is a concern for us that, especially that, for me anyway, that there's only one provider that accepts Medicaid. And that's gonna, we'll have the poor with us, so we gotta talk about that, how we can do. With no further ado, and I want to thank Councilwoman Simon. This was initially in her Environment and Education Committee, and so she has a full slate, so we were happy to accommodate. I think it originally, as she stated, should have fell in this committee, but you were welcome in both, so you're welcome. Any miscellaneous business? Hearing none, seeing none.